Hey everybody, it's your girl Megan. How you doing? So today I'm going to talk about a couple topics kind of that all relate. So it's self-care for ED nurses. We're going to talk a little bit about burnout and things that happen when you don't take care of yourself. So as you know, being an ED nurse is really hard, and a lot of us suffer from burnout. What's the word they use for it? Sympathy, I don't know. There's something, they call it PTSD. A lot of nurses suffer from that. Anyway, there's lots of terms being thrown around nowadays. Secondary traumatization, Anyway, bottom line is ED nurses are suffering. And they're suffering like never before, as we're being treated worse than we've ever been treated. And violence against nursing is escalating, and nurses are leaving the field. ED nurses are leaving the field in droves. So I wanted to talk about some self-care, share a little bit with you, leave a couple tips, and try to help you guys. So the most important thing about self-care for any nurse, but ED nurse in particular, is make yourself a priority. Don't be afraid to say no. You know, they're always going to be short-staffed. They're always going to be, oh, can you pick up an extra shift? Oh, can you stay late? Oh, 4 hours, we need somebody to help out in triage. Don't be afraid to say no. They're always going to want more from you. An occasional shift is okay. I mean, everybody needs extra money now and again, but they will take from you more than they will ever give to you. Don't make the mistake of thinking that you're not replaceable, because no matter how long you've been at a hospital, how much overtime, how much loyalty you've put into it, you're replaceable to them. And if you disappeared tomorrow, they wouldn't think a thing of it. So make yourself a priority. Picking up extra shifts constantly is just going to burn you out. If you need to have more income, get a second job. Best thing to do is have it be non-nurse related. I know nurses who have retail jobs. I've used to do framing. That was one of my favorite jobs. But you'll get burnout quicker if you spend a lot of time in the same place. And not to mention the patient population. If you're spending 60 hours a week in the same ED, dealing with the same frequent flyers, the same administration, the same clicks, you're gonna get burnout. So I advise not to pick up extra shifts in the same ED. You're gonna get burnout faster that way. And it does not do anything really to build the hospital's loyalty towards you, because the hospital has no loyalty to anything except the almighty dollar, okay? So it's not gonna help you. It's going to burn you out. You need to make yourself a priority, because you are not a priority to the hospital, okay? Let's see. Be greedy with your personal time. Number two, be greedy with your personal time. To take care of yourself, go to the gym. If you like to get massages, do that kind of thing. I don't care if you have to make fucking appointments for that shit. We all got kids and lives and shit where we have other things to do, but you gotta make time to do shit for yourself. Otherwise, and literally sometimes they are appointments, doctor's appointments, be greedy with that time. Don't fucking pick up an extra shift. If you want to go to the fucking gym, and they ask you to pick up an extra shift, gee, sorry, I have an appointment. Yeah, you do. You have an appointment down at fucking LA Fitness, taking your raggedy behind up on that treadmill. Be greedy with your personal time. Don't give it up for anything. I mean, obviously, if your kid falls down and breaks a leg, okay, don't go to the gym. Take your kid to the hospital. But be greedy with your personal time, because if you don't feel good, if you don't take care of you, you can't take care of anybody else, okay? So be greedy. Find a hobby. If you have to, do crafts or whatever, but do something that gives you some kind of joy in life, some kind of pleasurable activity. If you like to jog, if you like to go, I don't know, get a dog, spend time with your dog. I mean, I have a dog, and I like to play with the dog, take the dog for walks, that kind of thing. Be greedy with that time, and don't give it up for anything, Just be greedy with that. And when you're at work, don't assume good intentions in people, okay? I know it's hard when you're working hard, and and you come to work and you take a report from a nurse and you see that this isn't done and that's not done or whatever. Don't assume. I mean, don't assume that they just didn't do it because they were fucking lazy or whatever. Just try to just assume maybe they just didn't have time. Just assume everybody has good intentions, okay? It makes it easier, because most people I know don't go to work thinking, yeah, I'm gonna go to work today, I'm gonna fuck up and be a total douchebag and not do shit. Most people don't do that. So, when somebody doesn't get something done or somebody fucks up, don't assume that they did it on purpose, and that, just to fuck you over or something. Just don't assume that. And, just learn to let shit go at work. Ask yourself, is it really worth it? Because sometimes I think, we get so, we let little shit get to us, it compounds because we get so much shit dumped on us. It gets to the point where even just the tiniest shit gets to us because we deal with so much shit. So sometimes you just got to ask yourself, is it really worth getting upset about this? Is it worth it? So sometimes you just got to let shit go. It's kind of like, when we ask patients, did you fucking die? Nah, I'm like, unless it's gonna fucking kill somebody, sometimes I just say, whatever, I don't give a fuck, whatever. So learn to let some shit go, because if you hold on to everything that pisses you off at work, you are gonna be one angry motherfucker, okay? I know personally, because I tend to do that. And, so, boundaries. Set them, stick with them, period, okay? If, you have a problem at work, say you have a patient that's, swearing at you, cussing at you, whatever, you know what? I don't swear at you. Don't swear at me. Boundaries. Set them. Stick with them. If they cross them, tell your charge nurse. Say, I will not take care of this patient. They're being verbally abusive, etc., or something. But remember, set boundaries. You do not have to deal with people's bullshit. If you have a nurse being a dick to you, say, you know what? If you keep talking to me like this, we're gonna have a problem, okay? Just learn how to set boundaries with people. If people are doing things that are making you uncomfortable, or no matter who it is, set boundaries. Let them know, hey, you stepped out of line. You don't talk to me like that, okay? I don't know who you think you are, but you don't need to be talking to me like that. And if you do it again, there will be a problem. Set boundaries. I had a problem once with a scribe speak to me any kind of way. And I let her know that if she were to speak to me like that again, there would be a problem. Boundaries. Just set them and stick with them. And don't accept treatment from people that you don't deserve, and you don't need to be treated any kind of way. And in the ED, you're going to have patients that are going to try to treat you any kind of way, and you let them know that you will not tolerate that type of shit. And if they continue, then you can either let the charge nurse know, let the security know, let the police know, because you do not need to take that kind of abuse from doctors, nurses, patients, anybody. So that is a huge deal with me. I've gotten to that point in my life where I don't deal with that shit anymore. And it's kind of sad that 45 years old, I finally learned how to set boundaries. When you're young, you need to learn how to set boundaries early. Get that so that you don't get put in a position where, you get burnout because you've taken abuse for too long from too many people. So, that. Let's see. Be aware of your feelings. If you start to dread to go to work, if you're starting to get a lot of anxiety, if you're starting to drink too much, because, we drink a lot. ED nurses do drink. If it's starting to affect you, that's kind of a red flag, okay? So you need to start to be aware of your feelings, and have some self-awareness about yourself, okay? And find some support if you have friends. And I don't mean friends like your nursing friends, like how y'all get together and talk about, talk shit, and then it devolves into this negative bitch fest where it just spirals into a bitch fest and everybody feels worse, and that's all it is. Non-nursing friends are great if you have them. To talk about shit, to kind of decompress, and to get an outside perspective. That kind of support is good. If you've got friends that work in other professions, that's great. But if you start to find that you've got some of those red flags, like the drinking and the anxiety and stuff, at that point, I think you should probably start to seek some professional help. If you're having suicidal thoughts. And I say this because I've worked in several EDs where we've had people commit suicide. Okay, and this is when burnout is not just burnout, okay? And I myself suffer from PTSD. And this isn't burnout, this is PTSD. And so many nurses do actually suffer from it. And when it gets to that point, I was diagnosed by a psychiatrist who worked for the VA with combat veterans after, an altercation with a patient. And self-care for me is different than, self-care for somebody with burnout. But, if you get to the point where you're feeling suicidal, and let me tell you, there are so many days after I get out of work where I would love to jump off the roof of the parking garage. And that's reality. And that's reality of dealing with PTSD. And you may have coworkers who are like that, and you need to seek help for that. And I'll put links for like the suicide hotline and for PTSD websites and stuff. But if you are struggling, and you should seek a health professional, because this is, reality for somebody with PTSD. So, it's living with PTSD is no fun, okay? And self-care for me includes trips to the psychiatrist, attempting well, not attempting, but I was resisting the urge to jump off the parking garage every day I get out of work. You know, it's a struggle, and it's something that when you have to live with it day in and day out, and it's been almost a year now, and you know, I've been I keep it on the lowdown. Obviously, I don't, you know, I was always told by my grandma, if shit don't look good, you don't put it on the front porch. But I cry every day I go to work. I cry every day I leave work. Every day I look at that damn parking garage, but I would never do that. I have children, and I am thinking of, well, I'm not thinking of, I want to quit nursing. So it's, I'm biding my time. I'm trying as hard as I can to get through just a little bit longer. But yeah, it's, if you see any of these symptoms in yourself, you know, the symptoms of PTSD, you're going to see the flashbacks, the intrusive thoughts. You're going to have hyper-aggressive behavior, outbursts of anger. Like I would get into fights with random strangers. You know, hyper-vigilance. Like I have to sit with my back to, you know, the wall. I can't go out in public and sit, you know, anywhere near a door. I have panic attacks often. I had one a couple days ago in the grocery store so bad. I told my husband, I'm like, you have to get me the fuck out of here before I lose my mind, or I'm gonna flip out and lose my shit. You know, anxiety, your heart races, you just feel like, you know, paranoia, any of these kind of symptoms, can't sleep, depression. I mean, just, if you feel any of those symptoms, please get help. Go to your primary care physician, your nurse practitioner. You can even get on the VA website. You know, there's lots of things out there, and I'll put links in there, but please, if you feel like it's getting, you know, that it's too much for you, or you need help, or even if you see a coworker who you think is needs help, by all means, you know, ask them if something's wrong, because like I said, I've worked in 3 separate ERs that have had nurses commit suicide, and it's real, and it's getting to an epidemic proportion. Nurses commit suicide more than any other profession, well, at a greater rate than any other profession, and we can't afford to lose anymore. So anyway, that's, you know, take care of yourself, take care of your coworkers, and, you know, take care of your patients. But most of all, take care of you, because if you can't take care of yourself, then who's going to take care of your patients? Who's going to take care of your families? And frankly, when it comes down to it, you've got to take care of you first. You just do. You know, your hospital will replace you the very next day if something happens to you. There is no loyalty. They're only loyal to the almighty dollar. And if something happens to you, your family is going to miss you. And, you know, you got to take care of yourself first. So that's the bottom line. So be safe. Take care. I hope y'all have a good one. Hope you like this video. Not the happiest video I've ever done, but anyway, if you liked it, hit the like button, hit the subscribe button. If you think there's somebody who could benefit from it, share it with them. So, all right, talk to you later.